What is the vitamin which is involved in this biochemical reaction where methyl malonyl CoA becomes oxynyl CoA? It is a vitamin B12, as all of you know very well. Now, what do you see in this ECG? There is a polymorphic ventricular tachycardia, which is called Torcidus dipointus. So, it is the sparfloxacin which is known to precipitate the Torcidus dipointus is what you need to basically remember. Can the online students can punch whether the voice is loud and clear? Vizag, Padmarao Nagar and everywhere, can you please punch whether the voice is loud and clear? Now, in this HIV positive individual, typically what you are seeing are called Kaposi's lesions, Kaposi's sarcoma lesions. Yeah, thank you. I hope Padmarao Nagar internet is little better for the GMC students, and we have a parallel session happening in our live classes covering the last 15 years of All India NEET PG question bank. So some of the students are attending that class. So, but we have a very good quorum of students today. So it is the Kaposi's sarcoma which is caused by human herpes virus 8. Now what is this acute lesion called as? It is called as ulcerative gingivostomatitis, which is typically caused by the Borrelia vincentii, is the one which leads to the development of it. Now, you have got the various drug. There is a drug which typically act on the rankle. It also inhibits the expression of the mitochondrial, of the expression of the genome. It will induce osteoclastic differentiation, and it will inhibit the osteoclastic activity and increase the blastic activity. So, which one it is? It is bortezomib, which is the one which reduces the rankle and inhibits the osteoclast differentiation and induce the osteoblastic activity, which is the bortezomib is the one which you need to remember. This is the typical injection of bortezomib. Now, there are various phases in which the viral replication occurs. First, the virus has to uncoat and transfer its DNA into the nucleus. Then there should be transcription of the mRNA, and in turn there is formation of the various structural proteins, and they become composed and the virion, daughter virion, get released. So at which step do you have the acyclovir phoscarnet like drugs basically act? They act at the inhibition of the viral DNA polymerase. That's the reason it is the step 3 at which basically step C at which they act. So this table is very important, doctor. I leave the literature for you. Please review that. A lot of times questions are asked, especially picture based schematic questions in pharmacology. There's a very high incidence of getting a question from the site of antiviral drug action is a favorite question in the NEET PG. Now in the glaucoma we use various drugs. They have different mechanisms of action. So what is the drug A? The drug A basically decreases the aqueous humor. So that is the typical function of beta blockers. The muscarinic agonistic drugs, they typically constrict the circular fibers, and and they improve the drainage. So that is the reason they are used in the management of glaucoma. Now there are Phaeochromocytomas, medullary carcinoma, and lumpy bumpy neuromas on the mucosa of the tongue. So this is the classical feature of the men type 2B is what you have to basically remember. Now what is this ultrastructural finding of the glomerulus? Typically this is called basket weave appearance, which is a very typical thing along with deafness. When the glomerular basket weave appearance is seen, that is the typical feature of histopathological feature of the Alport syndrome, the electron microscopic finding of the GBM in case of the Alport syndrome. So this is a normal GBM, and typically this is an example of a thin GBM, and this is an example of abnormally split laminated GBM, which is then called the basket weave appearance, is what you need to understand. Now, what is this subtype of lymphoma? You are finding cells with lacunae around the lacunae which is around the cell, right? So here you can see the lacunae around the cell. Here you can see the lacunae. They are called lacunar cell type of Reed-Steenberg cell, which is typically a feature which is seen in the case of the nodular sclerosis type of lymphoma, is what you need to appreciate. Now the polyp histology is shown, and this polyp is discovered in a person with mucocutaneous hyperpigmentation, which is an example of Peutz-Jeghers polyp. Now what is this organization called as? It is called as Helpage India. So what is the purpose of this Helpage India? So how do the picture based questions come in NEET PG when it comes to preventive medicine? Some of the logos of the international organizations you must be very sure, right? Similarly, hygrometer, anemometer, all those things. At least once you need to look at that this thing. Then another type of picture based questions, they come on the filarial mosquito, then malarial mosquito, and the type of eggs that they lay. So on those things questions come, picture based questions. So that is our experience with the previous NEET PGs, and in the future also you can expect such questions. So fundamentally, income generation and microcredit is considered to be one of the important purposes. Now this is typically patients have fluorosis coxvalga. It is typically more common in the communities which are jobber eating, is what you need to appreciate. So what is this condition whose radiographic picture is shown? Here you are seeing central bronchiectasis, which is feature of allergic bronchopulmonary aspergillosis. So it is allergic sensitization to the aspergillus in the lung is the typical feature which you have to basically remember. Now a trefoil has been shown to you. Typically this is a warning symbol of radiation hazard, and commonly asked question is what is the angle between one blade and other blade? 45 degrees. That is another MCQ which you need to be very sure about. Now you are seeing calcifications which are typically located in the areas where adrenals are there. Bilateral adrenal calcification is this typical radiograph. So it is a feature which is seen with Addison's disease, when there is an autoimmune destruction of the adrenal into that dead tissue of adrenal, there is a calcification which is called dystrophic calcification which occurs, and that is a feature of the Addison's disease. Now the chest X-ray within 5 days, please remember, within 5 days of MI, what do you see? Cardiac enlargement. So whenever within 5 days if it occurs, it is myocardial rupture, is what you need to appreciate. Within 72 hours if it occurs, you should think of papillary muscle rupture leading to acute mitral regurgitation, leading to acute pulmonary edema along with cardiomegaly. Within first 72 hours, that is what you need to remember about the complications of the myocardial infarction. Now the dermatological condition where there is a hypopigmentation shown, very common in the Indian scenario, spotted if you have gone to dermatology clinic. Tinea versicolor, which is typically caused by Malassezia furfur. So it is one's own autochthonous flora from which it will basically arise. So Griseofulvin is not effective. So Griseofulvin is not effective against the pityriasis versicolor. Even Griseofulvin is also ineffective against candida. That's what you have to be very, very sure about. So this is a sexually transmitted disease, and the lesions on the palms have been shown. These are the classical secondary syphilitic rash on the palms. So that is the reason benzathine penicillin even today is the best drug for the management of syphilis, is what you need to basically remember. Patient has got hypogonadism, obesity, mental retardation and polydactyly, along with the bony spicule appearance, which is retinitis pigmentosa. All put together is a classical case of Lawrence Moon Beadle syndrome, is what you need to remember. With this phase of the sleep on EEG, what is this phase of sleep on EEG? You find it's called a slow wave pattern on EEG with lot of delta waves predominating. So which phase of the sleep cycle you have? Awake, stage 1, stage 2, 3 and 4, NREM, and after that you are having REM. So the stage 3 and 4 of the NREM are called as slow wave sleep. Stage 2 is the place where you find sleep bundles, right, K complexes. So during this slow wave sleep, people will get sleepwalking as a habit. The sleepwalking is a complication that typically occur, is a thing that occur. Jojo is asking a very good question. Sir, if Griseofulvin is not effective for tinea versicolor, what is effective? We use selenium shampoo. Selenium is the one which is used to treat, and just review the complete topic of tinea versicolor. Yeah. So somnambulism occur typically during the stage 4, otherwise called delta, or a slow wave sleep. Now teeth which have been shown, what are they called? Mulberry molars, which is a typical feature in the case of the congenital syphilis. Patient is having intermittent dysphagia, and he is also having a foul smelling breath and gurgling noises in the neck. What do you see here? Juncker's diverticulum. It passes through Killian's dehiscence. So where is the Killian's dehiscence located? Between thyropharyngeus and cricopharyngeus muscle, between the two, the Killian's dehiscence is located, is what you need to remember. There is a hypotensive patient and he presented to emergency surgery. On CT, what you can see? Abdominal aortic aneurysm which has undergone the rupture. Right? So he is being put under which level of risk in American Society of Anesthesiology classification? ASA has given, based on the physical status, a classification. A normal healthy person is called PS1. Patient with mild systemic disease like hypertension, diabetes, bronchitis is PS2. Patient with severe systemic disease leading to functional limitation, for example a diabetic patient with a vascular complication, is basically PS3. PS4 is typically there is a threat to life like advanced pulmonary renal or hepatic dysfunction or CHF, is PS4. Then PS5 is the one who is not expected to survive without the surgery, like increased intracranial pressure or ruptured abdominal aortic aneurysm. That's the reason he is put under ASA. PS5 is what you need to basically remember. Some of you are going to become the finest anesthesiologists. What is the job of anesthesiologist? Pre-anesthetic checkup and stratification of the patient based on his comorbid complications. That's very important. Now, what is the most important cytokine implicated in this? What is this? They have silvery scales, which are classical of psoriasis. So, it is the interleukin 17 which is implicated in the pathogenesis of the psoriasis, is what you need to basically remember. A patient retained in this posture shown in the figure, fundamentally it is a case of cataplexy, which is typically a feature of stuporous catatonia, is what you need to remember. Now, what is this a radiological feature of? You are finding ring shadows which are typical of bronchiectasis, is what you need to basically remember. Now, what is this radiological feature shown in the HRCT? basically. It is showing eggshell calcification of the hilar lymph nodes, eggshell calcification, which is a very, very typical feature which is found in the case of the silicosis. Then what is this radiological feature is in favor of? You can see the involvement of the pedicle. It's called winking owl sign in radiology, which favors that there is a metastatic lesion to the vertebrae rather than a primary bone malignancy of spine. So it is a case of metastatic destruction of the vertebrae. Metastasis, destruction of the vertebrae is what you need to remember. Winking owl sign. Now there is a crushing osteochondritis in what is this area? Capitulum. What is that called as? It is called as Spanner's disease is what you need to appreciate. Now what is this lesion which is being shown here? So here you are finding presence of a nidus. So presence of a nidus is a very important feature of osteoid osteoma is what you need to basically remember. Then there is a malignant bone tumor which is showing the typical onion skinning, which is a feature of Ewing sarcoma, which typically occur in the shaft of the bone, which is called the diaphysis of the bone. Invariably a question comes in bone tumors, and that would be on features like from where what are the tumors that come from epiphyses, metaphyses, diaphyses. All this exam hall may you should not think twice. You should go and attack the bullseye. That's very important. Now, which wrist fracture require a open reduction and internal fixation where no role for conservative surgery is there? Typically, whenever a Barton's fracture, it's an intra-articular fracture. If you don't properly reduce it, then it will lead to arthritis. So that's the reason you have to. Then what is this radiological feature shown? This is called crazy paving. Crazy paving is a feature of, typically crazy paving sign is a feature of acute silicosis. Is what you need to basically appreciate. Now doctor, what is this lesion in the figure is, and how do you want to basically treat it? So this is a knee joint where you are finding the transverse displaced fracture of patella. So for that the treatment is tension band wire fixation is considered to be the management of choice. Now in this test shown, the person is raising the thumb and trying to touch the pen. What is this called? Pen test. So typically the pen test is a test for median nerve, and it tests the abductor pollicis brevis. Whenever you are trying to touch the pen with your thumb, then what is happening? Pollex fingers abductor is functioning, and that is supplied by median nerve is what you need to remember. Now patient radiograph is being presented. It is showing posterior dislocation of the hip. In posterior dislocation of the hip, what do you see? Shortening, internal rotation, adduction of the limb in slight flexion is considered to be the typical posture, and attitude, flexed, internally rotated, adducted is a feature of posterior dislocation. Now the patient presented with the watering of the eye. What is the condition? Typically it is an example of trichiasis. Then there is a recurrent lesion like this. What is this lesion fundamentally? This is a chalazion. Whenever recurrent chalazion is there, then think of sebaceous cell carcinoma, especially in elderly population. Now what do you see in the eye? Calcification of a mass, which is a retinoblastoma. Often they have an associated osteogenic sarcoma arising is what you need to understand. Now what is this ophthalmoscope instrument called as? Keratometer. The purpose of the keratometer is to calculate the curvature of the cornea is you should remember. Now the ophthalmoscopic appearance has been given. In the retina you are finding small nodular structures which are called Dallen-Fuchs nodules, which are a feature of sympathetic ophthalmitis. Now what is this maneuver? where the person raises the head, lifts the head and exercises. So that is called shaker's maneuver. It is to strengthen the laryngeal movements during the swallowing. This typical exercise is being advised, is what you need to remember. Now that is all the story of image based questions. Let us, so what is your score out of the 45 questions of image based? Almost 70%. So image based questions, we don't know whether they give 60 questions or 80 questions. Last time in, how many came? Huh? APPG is lot of questions, but NEET PG, most of the people's experience in the last year papers is not more than 10 to 15 questions in a good number of, even DNB also. But still we don't know, better be prepared to have a practice of answering the image based questions every week is very, very important. Marks distribution of 240 questions has been given to you, no? Only thing is how many image based questions come from which topic, there is no definite guideline. So anything can come, 30 questions in all 20 questions in medicine can be image based, right? Only 2, 3 and more number in biochemistry can come, doesn't matter, right? Now, epithelial component of the thymus gland, from where does it develop, doc? It typically comes from the pharyngeal pouch 3. Mullerian inhibiting hormone is produced by the Sertoli cells. And right atrium, wherever the vena cava is entering into it, there is a valve, rudimentary valve, which is present. This is a beautiful question, doctor. How many phalangeal, just do you have? 1, 2, 3. 3 phalanges have. What is meant by proximal phalangeal joint between the metacarpals and phalanx? You have metacarpophalangeal joint. After that, the first joint is called proximal interphalangeal joint. The second one is called distal interphalangeal joint. So that's how we have metacarpophalangeal, proximal interphalangeal, distal interphalangeal joint. Now, if you look at the flexion, there are 3 things involved. The interosseous and lumbricals, they help in the proximal phalangeal flexion at the metacarpophalangeal joint. Metacarpophalangeal joint level mein phalangeal flexion is caused by interosseous, flexor digitorum superficialis supplied by median nerve, and the flexor digitorum profundus both by the median and ulnar nerves. But if you look at the middle phalangeal flexion at the proximal interphalangeal joint, that is only by the flexor digitorum superficialis and profundus. If you look at the distal interphalangeal joint, it is only by the flexor digitorum profundus. So this rule you have to remember. Definitely they will ask a question. So where are the lumbricals involved, doctor? Metacarpophalangeal joint flexion and interphalangeal joint extension. You can easily remember L is lumbrical. Flexion and metacarpophalangeal and extension and interphalangeal joints is what you need to remember. Now, about the various anatomical levels. Where is the thyroid cartilage, carotid pulse? They are all located at the C5 level. In the skeletal muscle, before depolarization of the T tubule, what is the important event that occurs? First, depolarization of sarcolemmal membrane occurs, right? And that in turn will initiate a cascade of events. Then adenylate cyclase is stimulated and cyclic AMP is produced. That is the mechanism of norepinephrine. Then after extrasystole, the beat which is being produced will have a higher level of contraction power. That's called extrasystolic potentiation of the beat is a typical feature. Then with the strenuous exercise, what will happen? The ventilatory rate will increase, oxygen consumption will increase, is what you need to remember. When there is a low pH, the low pH will inhibit gastrin. When a lot of acid is there, you don't need gastrin because gastrin stimulates acid production. Then when there is a high affinity, it has got a low Vmax, low Km. What is Km? Km is the substrate concentration at which half maximum velocity is achieved. If there is a high affinity, means even at a low substrate level only, it can achieve high maximum velocity, half the maximum velocity. That's the reason it will have low Km. During DNA repair, typically the nick strands which are adjacent to the thymine dimers, how are they repaired? It is the endonuclease whose function is to nick the thymine dimers. And xenoderma pigmentosum is fundamentally a problem of inability to repair the pyrimidine dimers. 5-end of the RNA processing, what will happen? 7-methyl guanine capping happens. And you must know what happens at 3-end, what happens at 5-end. RNA is one of the very high yield topic. Now, to know the response of therapy of interferon and ribavirin, what is the most important parameter that you need to know to prognosticate a patient who has got hepatitis C? Whenever hepatitis C is found, the genotype of hepatitis C is checked. Is it hepatitis C type 1, type 2 or type 3? And accordingly a call is taken. Contaminated berries typically transmitted cyclospora. Parvovirus B causes erythema infectiosum, polyarthralgia, a plastic crisis. All these are the problems with Parvovirus B. Brucella is not gram positive, it is gram negative, is what you have to be very clear about. Now the calcium ions typically act on the IP3 receptors, inositol triphosphate receptors. Then regarding peptic ulceration, H. pylori is the most common organism. The antiarrhythmic agents, if you look at digoxin, it will increase the calcium entry into the cells and decrease the efflux. Now, to avoid using ACE inhibitor, what is the important reason? If there is a bilateral renovascular disease, but unilateral renovascular disease, ACE inhibitor is the drug of choice. Now, regarding xanthines like theophylline, they increase the effect of beta 2 agonists because they will also act at cyclic AMP level by being phosphodiesterase inhibitors, xanthines. Now, coming to the bipolar disorder, acute maniac phase, what do you want to use? We want to use prochlorperazine. Lithium and carbamazepine are more often used prophylactically, but if acute anti-maniac drug is required, then you have to go for an antipsychotic like the prochlorperazine is what you need to basically appreciate. Regarding hypoxemia, some of the causes of hypoxemia are responsive to oxygen therapy. Some of them are not responsive. Whenever ventilation perfusion mismatch conditions are there, V by Q mismatch, they are not responsive. But if you take ARDS, it is very much, initially it will be responsive. The moment the ventilation perfusion mismatch state comes in case of ARDS, then it becomes unresponsive. That's the point. Now, right shifted oxygen dissociation curve of the hemoglobin. So you must know what lead to left, what is the right shifted, what is high affinity, what is low affinity for oxygen, all the factors, 100% you should be sure. Hypoglycemia is a feature of mesothelioma, paraneoplastic feature. Apolipoprotein E is the one which is implicated in type 4, in type 3 hyperlipidemia. It is also called Broadby disease, apolipoprotein E deficiency, and that will increase the chylomicron remnants and ideal and increase the serum triglyceride is what you need to basically remember. Spike and dome appearance is typically a feature of membranous glomerulopathy. Then how do you know in a case of glomerulonephritis whether an alternate pathway is affected or a classical complement pathway got activated? Typically, whenever the alternate complement system is activated, then that typically lead to normal serum C2, decreased C3, normal C4. That is the typical combination that you basically come across. Then regarding diadems, what is the extracellular coat of the diadems is made up of? It is made up of silica, not magnesium. Now, prostate putrefies very late. Carbolic acid, zinc chloride, strychnine and arsenic and antimony poisoning, there is a delay in the putrefaction. In the arsenic poisoning, typically we collect bone biopsy, hair samples, nail clippings, they are the ones which are basically collected. Then cephalic index of the population is typically between Indian population is 70 to 75. Whenever there is a lobar hemorrhage in an elderly patient without hypertension is the word there, you have to suspect cerebral amyloid angiopathy. Now, the condyloma accumulata, interferon alpha is considered to be the management of choice. Diffuse rash involving palms and soles, you should think of syphilis and VDRL should be done. In obesity, what is the story about leptin? Leptin is produced by adipose cells, not hypothalamus. Now, regarding the various intervals, WPW syndrome, there is a shortening of the PR interval because it will bypass the AV node. Directly atria and ventricle are connected. If the AV node is there, there is a AV nodal delay leading to PR interval between P wave and QRS complex. That becomes shortened because of this bypass tract in WPW syndrome. To say that it is LVH, V5, V6 are left-sided leads, V1, V2 are right-sided leads. Then lead 1 is also pointing towards left, right? Then there are certain criteria. When do you call LVH? If the R wave in the lead 1 is more than 15 mm. Then the R wave in the lead 1 or 2 or AVF is more than 20 mm. Then AVL is also a left-sided lead. So if the R wave in the AVL is more than 11 mm, or if the R wave in V5, V6 which are the left-sided leads is more than 26 mm, if the R wave in the lead 1 and the S wave in the lead 3 is more than 25. You don't need to remember all this because simply know what are the left-sided leads, right-sided leads, bus, more than that. Troponin is elevated until when? Until 7 to 10 days troponin is elevated. That's the reason on 8th day or 9th day if you want to know whether this is a reinfarction, troponin cannot help because 10 days back troponin which is elevated still remain high. So you don't know whether it is due to reinfarction or not. To know the reinfarction, CPK-MB is the best investigation is what need to be remembered. Whenever magnesium deficiency is there, all the ECG findings will be similar to hypercalcemia, not hypocalcemia. Hypomagnesemia ECG is equivalent to hypercalcemia ECG is what you need to understand. CLL, in elderly people, very benign form of leukemia is CLL. And it's the most common leukemia in the case of the elderly people who are above 70 is what you need to understand. You call it as fibromyalgia only if the ESR is normal. If the ESR is elevated and somebody has diffuse aching body pains, that is not fibromyalgia. Okay. Then, and similarly, to call fibromyalgia, complete blood count should be normal. If somebody had an infection with myositis, you call fibromyalgia? No, not accepted. That's important. Pneumoconiosis, Kaplan's typically occur in those who have rheumatoid arthritis along with coal workers, anthracosis, not silicosis. Now, phenytoin intoxication lead to nystagmus, which is a gas-evoked nystagmus, classically by causing a cerebellar dysfunction. Lymphangitic inflammation, inflammatory streaking on the leg. Lymphangitis is typically infection caused by streptococci. Common migraine. How do you want to clinically manage? Of all the drugs, the only drug effective in managing the common migraine is ergotamine tartrate, is what you need to basically remember. Whereas you take verapamil or amitriptyline, which is being mentioned over here, they're all only prophylactic or a preventive therapy is what you have to understand. Now coming to the migraine, prophylactic treatment of migraine. Sumatriptan is more for acute management, not for prophylaxis. So that is all for today, doctor. So remaining questions, kindly go through the explanatory booklet and try to see your scores improve every day.